everybody, this is Molly with the marketing department at Phoenix Children's Hospital, and we are here again for another Facebook Q&A today with two of our experts from the Centers for Cancer and Blood Disorders. I always struggle with that, at Phoenix Children's Hospital, and we are talking about hemophilia. So start by introducing yourselves to our audience.
Hello everybody, I am Dr. Christine Knoll, and I'm a pediatric hematologist, and I'm the director of the Hemophilia Treatment Center here at Phoenix Children's Hospital.
And I'm Dr. Esteban Gomez. I'm the physician who helps especially with our adult hemophilia patients and other adult bleeding disorder patients.
Great. So as I mentioned, we are talking hemophilia. If you have questions, as always, please put them in the comments and we will try to get them answered as we go. If not, we will get them answered after the fact. So let's start out. What is hemophilia?
I'll take this one. So hemophilia is a congenital bleeding disorder in which your body does not make enough of a specific clotting protein in order to form a blood clot and stop bleeding. And the specific clotting proteins are factor 8 and factor 9.
So if you have hemophilia, basically, just in simple terms, it means you don't stop bleeding when you
Correct.
cut or
Correct.
whatever.
Correct.
Okay. So how serious is this?
There's different severities, so it depends on the severity. So there's 3 severities: mild, moderate, and severe, which of course the severe patients have more bleeding issues compared to the mild patients, but it can be very serious.
Is it something you're born with, or?
It is something you're born with, yes. It's typically congenital. There are rare cases of you acquiring hemophilia, but they are very rare. But the vast majority of our patients have congenital hemophilia.
Okay. So you mentioned, the different severities. Is there more than one type of hemophilia that people can have?
Yes, so hemophilia A is a deficiency in factor 8, and hemophilia B is a deficiency in factor 9. And then within those, you can have mild, moderate, or severe of those types.
So can you talk a little bit about what factor 8 and factor 9? I'm sure it's complicated, but if you could simplify it, that'd be great.
Yeah, so factor 8 and factor 9 are 2 of many clotting factors and clotting proteins within the clotting cascade that again work to form a blood clot when you need to stop bleeding, whether that is a spontaneous bleeding episode or whether that's a trauma-induced bleeding episode or a surgery-induced bleeding episode, and you just essentially you are unable to form a clot to stop.
So that can be pretty scary, I'm sure, for
Absolutely.
kids
Absolutely.
and their parents.
Mm-hmm.
So how does the person have hemophilia? I mean, how does it happen?
Right. So if somebody does not know about a family history of hemophilia, and I should mention that this affects mostly males. Okay. And so due to the genetics of it, and so it affects. If somebody does not have a family history of it, then typically, if it's a severe hemophilia, they typically are diagnosed in infancy, within the first year of life. Whether that is if the boy gets circumcised, whether it's bleeding from a circumcision, bleeding from when they do the newborn screens with the heel sticks, will have a lot of oozing from that. And if they don't have any bleeding with those issues, which can happen, or just maybe a little bit more than expected and it doesn't get picked up, then as they get older they'll start noticing bruising, significant bruising, and then as they start getting mobile and crawling or walking, they'll potentially see some very large bruising or even joints getting swollen or bruising or muscles.
Okay. So males get it more than females, but I assume you do have some female patients that you treat as well?
We do. We have very few though. We really only have a couple of patients that have what is called acquired hemophilia. And again, it's really rare, and typically it does go away and is not lifelong. Typically, if you're able to treat it.
But the genetic one is pretty much lifelong.
Lifelong.
Yeah.
Correct.
So is it possible to go through your life without knowing you have it?
We have some mild patients that can get into adulthood without knowing it for sure. Severe is much less unlikely. Probably the oldest I've seen severe patients being diagnosed is maybe around the age of 2 or so. Typically, if the family thinks back, they can then remember some potential signs of it before, but it's unlikely to have a severe patient that gets into adulthood without being diagnosed. But definitely we have some mild patients that may get a procedure and then they have a bleeding episode, and that's how they get diagnosed, or a sports injury or something like that.
So for those more milder patients, what is sort of the protocol to diagnose that?
So without a family history, then it's probably going to be, again, more bleeding with an injury, and just for the treating physician to think about that. Why is this patient having so much bleeding, or such a significant bleeding episode, or bleeding after a procedure? We sometimes do have patients that in preparation for procedures will get some screening labs, and that it will sometimes get picked up then, and then they'll get sent to us before the procedure's done, but not always.
Okay. So if I have hemophilia, or if, let's say, a man has hemophilia, what are the chances of that man passing it on to their male child?
So let me just talk about the genetics a little bit. So it affects mostly males because it is an X-linked disorder, okay? Meaning the vast majority of patients, the mother is a carrier, okay? And so we have a few patients that mother is not a carrier, and the mutation starts in the affected patient themselves, but that's rare. So typically the mother is a carrier. So if mom is a carrier, each boy she has, there's a 50% chance that boy will have hemophilia. Each girl that she has, there is a 50% chance that she will be a carrier. Okay. And then for the affected male himself, all of his daughters will be carriers.
Oh wow!
And then if he has sons, it stops. It does not get passed on.
Huh. So, do most women not know they are carriers?
It's usually, we have about a third of patients get diagnosed from what's called a spontaneous mutation, where there is no family history, and the mother is found to be a carrier. So it's about 2/3. There typically is a family history. So, but yeah, it's a decent amount of patients that don't know. For
Right,
sure.
because if they don't have symptoms, they
Exactly.
Huh, that is a fascinating science lesson today. So how do you treat hemophilia? I mean, how often are these kids coming in, and what do you do when they come in?
Right, so it depends on the severity, and the mainstay of treatment is really to replace what you're missing, essentially. So if you don't have enough, or you're missing the factor 8 or the factor 9, there are factor products that currently are only be able to be given through an IV, and you replace the factor 8 or factor 9 through the factor infusion through the IV. Now, for our there are some other products that we do use for milder patients that can assist with bleeding episodes, but factor is sort of our mainstay of treatment. And for the milder patients, it's typically on an as-needed basis. When they have a bleeding episode, when they need a procedure, if they have a sports injury or something like that, then we'll treat them with factor. For our severe patients, it's all about prevention. We know that those patients are going to have bleeding episodes, and sometimes they'll have spontaneous bleeding episodes where they don't even remember that it happened. So those patients, we will put them on a regimen of, depending on the type, about 2 to 3 times per week, and in order to prevent bleeding, which means they have to be able to either infuse themselves at home eventually, or family learns, or use a central line.
So does that, if they are, well medicated like that, if they get a cut, does it necessarily bleed as bad as it would?
Not typically, and honestly, even if they're not medicated, their cuts probably don't bleed very often. There are more joint, soft tissue, muscle bleeding, and actually we don't have tons of patients that even have mucosal bleeding. The nose bleeds and things like that that you would think of isn't very common in hemophilia. We see it, but it's not super common. More common in other bleeding disorders.
So it's sort of the more hard to see, hard to know, and that's probably why it's more dangerous than just a cut on the hand or something. Interesting. So what is life like for someone who has hemophilia? It doesn't sound like a death sentence. It doesn't sound
Absolutely
like you can't
not.
live your life.
No, absolutely not. It's definitely normal life expectancy. We're fortunate in this era that we have very good treatments. It's also a very exciting time in hemophilia right now where there's a lot of research being done to even further improve the treatments. I of course don't have hemophilia, so I can't speak for the patients, but our goal and our hope is absolutely that they have a normal life and they're able to do the activities they want to do the sports they want to do, be active, stay active. There are some restrictions in sports and activities that we typically don't like them to do because it's at a higher risk.
What kind of activities might those be?
The major, contact sports, so football, hockey, boxing, wrestling, things like that.
Okay. So for kids, we kind of mentioned this earlier, but for kids, bruises are pretty common, you know. But for a child with hemophilia, is it dangerous? Is it more dangerous?
Yeah. So all the hemophilia patients they're gonna get typical bruises too. The typical bruises that they get are not typically life-threatening. It's when they get a large bruise that may involve a large space of soft tissue or a large muscle, and those can definitely be life-threatening, very painful, and definitely significant enough where we need to treat that for sure.
But they would know, obviously they know it's happening. They could.
Typically, that's one of parents' fear is how am I going to know? What am I going to see? Especially a little one that can't tell you. So it's often just in the babies it's going to be just very fussy and irritable. And soon they'll be able to tell you they're in pain, and then maybe not wanting to use an extremity, favoring one side over the other. And then our older kids and adults, they tell us that they know when it's a bleed versus another type of pain.
They really get to know their body.
Yeah, definitely.
It feels different.
Sure. So how often do people or kids with hemophilia come to the hospital? I mean, maybe like come to the emergency room or things like that. Is it something that they do all the time?
We hope not. So ideally we really try our best to keep them out of the emergency room. And we things they could come in for is if they fall and have an injury that they are having too much pain to be treated at home, or not able to be treated at home. And a lot of those patients, if it is the case, we try to get them into the clinic versus having to go to the emergency room. But it's definitely not a common or routine thing for them to have to come to the ER frequently. Yeah.
That's good.
Yeah, a lot of families are able to learn how to manage the bleeds at home.
Which is the goal.
Yeah.
Right, like any chronic illness or condition. Now, Dr. Gomez, something you all might not know is that actually here at Phoenix Children's Hospital we treat adults as well. It's one of the few departments that actually treats adults as well as children at the Children's Hospital. So talk to us a little bit about the patients you see and how you approach their care.
Yeah, so I'm focused on our young adult hemophilia patient population, and a lot of these patients are patients that have come here their whole life to get their care for their hemophilia, and then as they get older, they still need to continue to get good quality care for their hemophilia to stay healthy. So we have a great team here at Phoenix Children's that's really focused and specialized on the care of patients with hemophilia. And myself and Lori Wagner's our nurse practitioner, and we also have a nurse coordinator that are all dedicated to the adult patient population and helping them with their own unique health needs. So it does, but I think it's fun for our patients, fun for our nurses,
to see them grow up. And
to see them grow up, and then sometimes it'll be a change of pace, for them to come to our
less crying, probably. So, I think a lot of people, or especially parents who have children with lifelong conditions, are often nervous about that transition of care from childhood to adulthood. So you guys kind of ease that way a little bit.
Yeah, exactly. Yeah, that's what we're here for, to help with that transition. So it's, I think, lot of the parents do such a great job of caring for these children with hemophilia, and then they get older, and it's time for the patients to start to learn and take that responsibility on. And so there's definitely a transition there where the patient takes on more responsibility, and the parents learn to let the patient take on that responsibility, and we do our best to help the families through that transition. And I think it's nice because we're able to continue to be their main providers. So
Right.
they're still seeing a lot of very familiar faces, but at the same time, there are things that just because they're getting older, we do need to make some changes too.
Sure.
So we help with that.
Sure. So how do you approach that adult care? I know you mentioned it a little bit, but what is your
Yeah.
sort of philosophy when you approach that adult care, especially as a child is
Yeah.
transitioning?
As the child's transitioning, our goal as a team, my goal also is to help the family, help the child to get that knowledge, and so that they can become involved in the medical decision making that's necessary. So, and help them learn to make those decisions, to take responsibility, to stay healthy. So, I think it's just natural as part of growing up. We all have to learn to become independent to some degree, and so, so there may, I think classically, there can be some bit of a rebellious type attitude, or some concerns like that. But a lot of our patients really understand we try to help them appreciate the importance of continuing to take good, to make good decisions to take care of their health.
Right. Yeah.
Because they have to start administering the
Right.
medication even as young children.
Yeah, and we definitely find the earlier we start the teaching and the transition, and we have some patients, as young as 7, 8 that are starting to learn to infuse themselves, and we have one of our nurses started a boot camp where we start teaching them. So all that just continues to.
Yeah, that's a great program.
Yeah.
It really teaches the patients a ton about their hemophilia, and then in learning that, they get a lot more excited about taking on the responsibility of their own care and learning to do their own infusions, which is very challenging for some of our patients.
Yeah, I imagine getting them ownership gives them a lot of good feelings.
Exactly.
Yeah.
Exactly. Yes.
And hemophilia is such a unique condition because it's passed on in families. So you're often seeing the parents, and you're often seeing their children. I mean, it's whole families coming in for appointments, right? I mean, talk about how unique that is.
Yeah, it's great. It's great for our team because we get to develop these relationships just like you're describing with the entire family, and it's I think it's our families also seem to appreciate the opportunity that the whole family can come and get the care that they need. So.
Well, they're all experiencing the same kind of things, so I'm sure there's a lot of discussion that happens.
Yeah, just at different levels, different ages obviously have different concerns, and then also we do see the moms who are carriers too, and guide them through, because someone can be what are called symptomatic carriers, and guide them through procedures, pregnancies, as well as just what to expect having a child with hemophilia.
Yeah. So, why is it important for us to treat adults as well as kids? Why did Phoenix Children's think that was, sort of an area we needed to support?
Yeah, so hemophilia, like you mentioned, it's a unique disorder, and it's a rare disorder as well.
Yeah.
And so there aren't very many places that you can go and get care from people that are specialized in the management of hemophilia or other bleeding disorders. So that's why it's really important for Phoenix Children's to be involved in providing care to those patients, because we are one of only 2 teams in the state that are dedicated to the care of patients with hemophilia and other bleeding disorders. So they're not very many.
Yeah, so it's a
Yeah.
unique thing to be able to provide.
Mhm.
And the adults are treated right here at the hospital as where the kids are treated, right? I mean, it's
Yeah,
all-
we see them in the clinic.
Probably bigger beds.
Yeah.
And if they do need to go into the hospital, and they're going to be in the hospital overnight, then our older patients are often admitted at adult hospitals, and then I can see them over at the adult hospitals.
So we have partnerships with
Right.
the different
Yeah,
hospitals.
so I've got privileges at some of the adult hospitals to go and continue to make sure that the patients are getting the care that they need.
Sure.
Yeah.
So if someone wants to make an appointment, whether they have a child or if they themselves as an adult want to see you, what should they do? Can they call the office?
Yeah, I think that's probably the best way is to call or call the main office, and then they are always welcome to ask to speak to somebody within the Hemophilia Treatment Center, and they would get in touch with either our admin assistant or even one of the nurses if they have specific questions.
Great. Well, we will put that phone number up on our at the end of this chat, and a link to the page as well. Thank you so much for chatting with us, and we look forward to hearing more questions if you have them. Thank you so much.